This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders. And this is the News Nugget for June 19th, 2018. Well, Congress is busy this week. We're actually not recording the News Nugget until Saturday, June 23rd. But Congress was busy this week, and we kind of held on to the News Nugget to be able to give Congress time to take action on a whole new slate of opioid bills in the House of Representatives that ultimately Congress passed yesterday, Friday the 22nd, in Washington, D.C., as it's trying to position itself to get legislation passed through the Senate before the August recess, when most congressmen and senators are going to begin their campaigns for re-election in the fall. This is big news because, as those of you who regularly watch the Health Law News Nugget know, the opioid epidemic and how to handle that from a national perspective has been very much on the minds of those in Congress on both sides of the aisle and at the White House during 2018. In this case, yesterday, when Congress passed this set of bills, it took a total of 50 different pieces of legislation that were going through various committees in the House and consolidated them into just over a couple of dozen of different pieces of legislation to address the opioid epidemic. And with that consolidation, ultimately Congress got the consensus that it was looking for. This slate of bills passed 396 to 14. A couple of Democrats opposed it and voted against it, with a little more than a dozen Republicans. But basically, when you look at 396 folks in the House of Representatives voting for a piece of legislation in 2018, in this day and age with so much controversy, it's fair to describe that as broad bipartisan support. So what's this slate of bills do? Well, it approaches all different aspects of the national epidemic that we're experiencing in opioid addiction, in particular focusing on methods of treatment that are alternatives to opioids, additional enforcement, which we talked about as a component of the federal budget for fiscal year 2018, kind of increasing that into years going forward. And then third, ultimately changing the law to make it easier for folks to gain access to care, including giving prescriptive rights to nurse practitioners and physician assistants for certain types of medication that can be used to treat the opioid addiction. So having said that, as most of y'all who watch the News Nugget know, just because the House of Representatives passes a bill, or in this case a slate of bills, doesn't mean we have a law yet. It's still got to go to the Senate. The Senate has to agree in every detail on the way that the House legislation has been put together, and if it does, then it goes down Pennsylvania Avenue for the president to sign into law. The Senate responded yesterday by saying that it was going to take up this legislation in July, take a look at it, and hopefully get things done before the August recess. The president responded by saying that he strongly supported, and the White House supports this legislation, and that it's an effective way to address the opioid epidemic. He also said, "Thanks for not asking me about immigration or Melania's jacket." It's been a busy week in Washington with all kinds of policy and politics going on. Thanks for watching the News Nugget this week, and we'll look forward to seeing you again next week. I'm Rich Sanders with Southern Health Lawyers.